I chose to do my topic on climate change and the public health economics. So, public health. Climate change is reshaping the landscape of public health economics, leading to increased healthcare costs, reduced productivity, and new demands on government resources. By implementing resilient infrastructure, preventive health measures, and cross-sectoral policies, governments can mitigate the economic and health impacts of climate change. However, a proactive approach that combines adaptation with climate mitigation efforts is essential for reducing future costs and protecting public health. As climate-related health issues continue to grow, this area of public health economics will remain vital to both national and global strategies for climate adaptation. And then I just added this picture because the healthcare costs are going up. Expanding on increased healthcare costs, climate change intensifies the frequency and severity of health conditions such as heat-related illnesses, respiratory issues due to worsening air quality, and infectious diseases spread by vectors like mosquitoes, such as malaria. Each of these health outcomes places added strain on healthcare systems, leading to increased demand for emergency care, chronic treatment, and preventive health measures. A 2021 study estimates that climate-related health issues add billions of dollars annually to healthcare expenditures in the U.S. alone. And then I use this photo to represent the respiratory issues due to worsening air quality. Labor productivity losses. Extreme heat, air pollution, and other climate-related health stressors decrease workers' ability to perform effectively, especially in outdoor and labor-intensive industries such as agriculture and construction. Rising temperatures alone could decrease global working hours by up to 2% by 2030, as projected by the International Labor Organization. This translates to billions of dollars lost in economic output, which also reduces tax revenues and increases financial pressures on welfare and healthcare systems. And then I use these pictures to represent the extreme heat. Specific health risks. So heat waves. With global temperatures rising, heat waves have become more frequent and severe. These events lead to an increase in heat-related illnesses such as heat exhaustion and heat stroke, which are particularly dangerous for vulnerable populations. Healthcare costs associated with treating these conditions rise significantly during heat waves, while increased mortality rates impose both emotional and economic tolls on communities. Next is vector-borne diseases. Climate change enables certain vectors like mosquitoes and ticks to expand into new regions, exposing new populations to diseases like malaria, Zika, and Lyme disease. Increased incidence of these diseases lead to higher healthcare costs for treatment, prevention programs, and public health interventions. In addition, illness and death from vector-borne diseases reduce workforce productivity, especially in affected regions, impacting local economies. Air quality and respiratory illnesses. Climate change worsens air pollution partly due to increased frequency of wildfires and higher temperatures that contribute to ground-level ozone. Poor air quality is linked to respiratory illnesses such as asthma and chronic obstructive pulmonary disease. The cost of managing these chronic illnesses over a lifetime is substantial, with the added burden of emergency care during extreme pollution events. Government strategy, investment in resilient healthcare infrastructure. Many governments are prioritizing climate-resilient healthcare infrastructure, including heat-resistant facilities and air conditioning in hospitals. For instance, in areas prone to heat waves, hospitals are upgrading to handle surges in patient loads during extreme weather events. Climate-responsive public health policies. Governments are integrating climate considerations into public health policies, such as early warning systems for heat waves and air quality alerts. These systems help reduce hospital admissions by warning citizens about dangerous conditions. Additionally, some governments are strengthening disease surveillance programs to monitor and respond to vector-borne diseases as they spread into new areas. Investment in preventive health and community resilience. Health systems are shifting toward preventive care to lower the long-term economic burden. Public health campaigns to educate people on heat safety, disease prevention, and air quality management are also becoming more common. For example, the EU has developed a framework for managing heat waves through public awareness, hydration stations, and special care for vulnerable populations. Cross-sectoral collaboration. Some governments are fostering collaboration between environmental, labor, and health sectors to create more comprehensive responses. For instance, policies aimed at urban greening, air quality improvement, and sustainable public transport not only help reduce greenhouse gas emissions, but also enhance public health and reduce long-term health care costs. Insurance and financial mechanisms. Insurance companies and governments are developing financial tools to buffer the economic impacts of climate-related health risks. Programs such as heat insurance and emergency response funds are designed to support communities during climate-induced health crises, while shifting some of the financial burden away from public healthcare systems. And then here are some of the sources that I used. Thanks for watching.